Thanks for staying on with us. You're watching Notepad. We are recording, of course, right in front of my house. Just stay at home is currently being bandied about for the past few days, particularly right after the Prime Minister's speech. Of course, in light of the restriction movement order, some focus has been given towards health-related companies. So joining me right now on the line is HealthMetrics, and this is a company that actually does the digital solutions or provides digital solutions for assisting HR companies when it comes to managing healthcare benefits. So joining me is, of course, Max Thum, Head of Revenue at HealthMetrics. Max, thanks again for taking the time to speak with us during this very interesting period of the restriction movement order. Let's talk a little bit about HealthMetrics and what you guys do.
Hi. HealthMetrics is actually a tech platform that serves predominantly three different stakeholders here. The first and foremost being the corporate clients. So we provide a technology platform for companies to manage their employee medical benefits. What it does is essentially it helps companies to automate their medical claims management whenever they actually provide medical claims or medical benefits to their employees. So what happens is that when the employees go over to any of these GP clinics that are using our platform as well, they're able to obtain cashless system. And what happens is that the entire billing and the entire reporting is being consolidated together for companies to further manage from there. Hence, we follow a framework of manage, measure, and improve here, where given the data that is being funneled in through an employee healthcare perspective, companies or at least organizations will be able to make more targeted decisions in terms of whether a health program is actually working out or not. Because end of the day itself, we want to be able to personalize some sort of program in order for companies to address, rather than having a general talk in terms of diabetes, in terms of hypertension. And really what happens if the client has predominantly a younger population, a talk like that may not be very suitable. Hence, we are able to help companies to figure out in terms of how they want to best manage. And if they are providing medical benefits, it's really to help them to determine whether the market is actually giving an accurate benchmarking in terms of their medical benefits, or are they giving over or under within market rates in this case. The flip side on the employees part of them is we give a mobile application, or essentially a employee self-service, just very similarly to how the users of Maybank to You are able to do banking themselves. The mobile application basically serves as a personalized app for the employees to be able to search for healthcare providers that are covered under their employer's benefit plan. And the other part is also helping them to determine if their medical entitlements have been used over the last 3 or 4 months within the financial year itself, and also keeping a history in terms of who they have actually visited for medical services. Because in some cases, when you are very close towards the end of the year, you don't really remember what you at least what you claimed for in the beginning of the year. So that actually helps them to determine further. And of course, the last one is really helping them to really submit medical claims whenever it's permitted by the company in this case, really to help companies that are employing mobile workers to be able to be part of the company in that case. And of course, the last part is really the most important part, our healthcare provider partners here. We are able to help them to provide a platform instantaneously. Whenever they use our platform, they are opening up themselves to potentially over 1,000 plus corporate clients throughout Malaysia itself. So it's an easy way for them to determine whether the employee that is coming in is being covered by the company's benefits, or essentially upfront telling them that certain treatments are not being covered by the company. Hence, it's easier and reduce disputes for company. And essentially, end of the month itself would really help them to consolidate all this billing, collect payments for corporates. So making their life a lot easier for that. So essentially, we are helping companies, or at least clinics in this case, to focus on really the most important part, right? To give the best diagnosis to the patient and then manage them from there themselves. So right now, I'm also proud to say that we have actually been working with over 3,000 plus healthcare providers across Malaysia, and it's a true great honor for us to work together with them.
I just want to learn a little bit more about whether or not the COVID-19 has been impacting companies like yourselves. Is it severely being impacted, or it's more manageable moving forward? Could you share a little bit about the ongoings with your companies and of course your employees as well?
Tech company itself, our business is very much tied together with the stakeholders that we serve, particularly for the corporate clients and also the healthcare providers as well. In corporates itself, currently most of them are on the cost-cutting measure. In fact, some are making drastic actions in terms of cost-cutting, such as offering voluntary unpaid leave for some of their employees. For digitalization, it is usually put at the last priority at the present moment, because most of them are just putting it on hold as one. For the existing clients itself, it's really about how we can reduce the risk of infection throughout the other employees in this case. So we are very much working together with our clients presently to offer them with solutions that can reduce this outbreak, if there is any within the company itself. And as I mentioned before this, our healthcare providers will also be affected. Hence, because of this reduce in footfall traffic for patients coming in as well. Because most patients will want to either walk into the A&E or essentially looking for dedicated sites for COVID-19 testing in this case, rather than actually going into a GP. That's what we see over here. And tech companies like us essentially very much depends on the business that we run. So for example, like e-commerce itself, hence right now the boom of e-commerce is real because people are staying home essentially. People are ordering online groceries, hence the number of orders actually increase. However, if you talk to tech companies that actually serve SME clients in this case, they will see a drastic reduction in business as well, because the SMEs right now are potentially on a cost-cutting measure, and many of them working with them could not actually increase the sales, that's one, and could not be able to see what other solutions that they can actually provide for these SMEs, because this SMEs is on a tight budget to begin with. And nevertheless, we aim to really assist our stakeholders during this time, and hopefully that the corporate clients, the healthcare providers out there are well equipped to weather this through this storm itself.
We'll take a short break before we continue our conversation with Max Thum of HealthMetrics. Don't go anywhere. This is Notepad. I am recording right in front of my house, largely because of us hearkening to the Prime Minister's call of just stay at home. We are currently in the early stages of the restriction movement order. We've been instructed, or we've been hinted, that this RMO would continue if situation persists, particularly when people don't want to listen or adhere to the restriction movement order. But that is, of course, an ongoing conversation. I, however, have on the line with me Max Thum of the company HealthMetrics. Let's talk a little bit about the ongoings of COVID-19. What do you guys think of the situation right now, particularly when we know that this is indeed not going anywhere or not abated, particularly when we talk about the number of cases being reported by the day?
First and foremost, this COVID-19 outbreak is a truly terrible situation, not only just for Malaysians, but on a global landscape as well. the infection rate has been skyrocketing for the last couple of weeks, so much so that the WHO has declared it as a pandemic globally. And from our perspective, we can see that businesses are greatly affected. Not only just the movement control order that is recently introduced, but also the entire scare of COVID-19 before this. Three particular industries that we see that was particularly affected, it was manufacturing, retail, and also hospitality as well. Because these companies tend to be very heavy on brick and mortar stores, and also very much dependent on plant sites, employees on plant itself. So with this reduction of movement of the population, it does significantly affect them a lot. And you might think that the healthcare providers out there has a high number of foot traffic, where people are more concerned whether they've got COVID-19 or essentially other less sinister the diseases itself. However, we do see a slight reduction in terms of GP visits, and initially we were wondering how come this actually did not go with the trend of increased GP visits whenever an outbreak like this happened. So we actually did a little bit of survey together with our GP partners as well. We actually realized that people tend to not want to come into the GP. Rather, they would prefer to call in sometimes. With the risk of being infected, if they are not infected, they're afraid that if they do walk into a physical location such as a GP clinic like this, they will get infected. And secondly, also, there is always this fear of being diagnosed with COVID-19. They're afraid to know that they are one of the people that are infected in this case. So there is a slight reduction there. Internally, we as HealthMetrics itself has been practicing social distancing, and also certain teams have been working from home since last week itself, with the initial precautionary measures to ensure that our team members don't get sick in the first place, and if any of them have actually recently gone to any large social gathering. So these are the things that we are doing internally. We also set up a triaging system where anyone who recently been to a gathering, or essentially visited someone that is tested positive for COVID-19, they are supposed to know, let their head of department know, which then escalates it further for us to do internal discussion. Because it is very vital for us to know who they met and chronologically determine to see who others who can potentially be affected or infected with this COVID-19 itself. And end of last week itself, externally, we've introduced a COVID-19 framework for some of the businesses that are with us, essentially. It's actually not only just for our clients, but it's also open up to public as well. This framework basically helps companies to be more prepared during this outbreak situation itself. It's really thinks about if there is an infection within the company itself, how can you actually quarantine the department itself, and how can you do adequate testing. Secondly, we also work with our healthcare providers to be having the on-site or at least home-based testing, so that the employees can be tested at the safety of their own home in that case. So these are some of the endeavors we have actually moved on, and particularly for the framework itself, we've actually taken much guidelines from the WHO and also KKM as well to localize it for the current setting.
That's it. That's our conversation with Max Thum of HealthMetrics. Remember, this is a very trying time for all of us, not just for people that are in the essential services, but of course general Malaysians. Again, people that are having or leading a life from the hand-to-mouth situation where they can't earn by the day. What's their story like moving forward? We've covered this area throughout the channel, throughout the day at Astro AWANI, but we want to make sure that we want to get everybody's voices heard. So share your thoughts and share your views just hit us up on our Twitter account at 501 AWANI, or leave some comment on our Facebook page. Let us know how things are with you guys out there at home. How are you going to cope? Is the subsidies or are the financial assistance being given actually helping you guys? Those are the kind of conversations and stories that we want to push forward. So until then, stay safe, stay at home, and remember to keep yourself abreast with all the news that are currently happening right now. Thanks very much for watching. Until next time.